Childhood obesity has increased across the U.S. as schools remain closed and remote learning continues. Pediatricians say children are now coming in weighing 10 to 20 pounds more than they did in March.
Childhood obesity has been plaguing the country.
There's another epidemic that's long affected children around the country.
More kids learning from home and all the stress that goes with it.
And now pediatricians are concerned.
Obesity rates were already at an all-time high. Now, one expert predicts that rate will bump up even higher, making nearly a quarter of American children clinically obese, with students of color most affected. As the pandemic rages, school-aged children are often stuck indoors and less likely to return to the classroom. Many are also missing school lunch and physical activity. But experts say that another factor is also likely to contribute: emergency changes to school lunch. Despite its stereotypes, school meals are healthier than they used to be. Credit is due to President Obama, whose Department of Agriculture significantly increased the nutrition standards for breakfast and lunch for the first time in decades. Now, though, the nationwide school shutdowns have caused the USDA to issue over 24 emergency waivers. This allowed for the distribution of free meals to all children, regardless of income, housing, or schooling. But it has also meant that schools are no longer subject to nutritional standards that were once in place before the pandemic. The waivers also made it easier for schools to switch from the National School Lunch Program to the Summer Food Service Program. The difference? Vegetables aren't required, and there are no limits on salt or calories. As a result, grab-and-go meal stations across the country are filled with shelf-stable snacks and heavily processed frozen food offerings, items that are logistically practical for families but lack key nutrients. At the same time, these changes haven't actually helped schools feed more kids during the pandemic. Despite best efforts, participation in the school lunch program has plummeted, while food insecurity is on the rise. It's possible that schools are simply overwhelmed, without the resources to feed students during an unprecedented period of remote learning. It's also possible that parents simply don't want the lower quality food currently being offered, or don't think it's worth the trouble it takes to get it. Whatever the reason, research shows that the food served to kids at home isn't as healthy as the food served at school. So this sudden drop in school meal participation is alarming. It's meant the past 10 months have looked a lot like summer, a time of year when schools typically serve lower quality meals and fewer students overall. It's also the time of year when kids gain the most weight. Now, summer-like conditions have lasted almost a year, and no one knows what the future health consequences for kids will be. While experts contacted by the counter remain confident that obesity rates have risen during the pandemic, the long-term trends remain unclear. Once schools do reopen, a good place to start will be by restoring the Obama-era school nutrition standards. The Trump administration permanently overturned restrictions on sodium, fat content, and whole grain requirements. And some advocates are also calling for one pandemic-era change to be made permanent. School meals should remain free for all, forever.